Welcome back to the Hand to Shoulder Solution, giving pain the middle finger. I'm your host, Petitto. I'm an occupational therapist and a board-certified hand therapist. I've been practicing since 2000. I specialize in treating orthopedic conditions of the hand through the shoulder, rehabilitate acute or new conditions that often the case are traumatic or they're just starting to surface, maybe something that's been has started for a while, and the symptoms have surfaced now. Additional to that is also chronic conditions that have been in existence and bothering the patient for quite a long time. And unfortunately, most of us wait for a while to go to the doctor or the therapist. But as with most things, the earlier you go in, the better. I'm bringing you this podcast because I want you to understand the fundamentals of how your body works and to recognize what your body needs so that you can obtain what you need when you need it. In healthcare in general, the service that you obtain and the timing when you receive it is very important for a good outcome. It's important for you to note that this is not treatment or advice. This is information sharing so that you may be empowered to make decisions for yourself in accordance with your healthcare provider. Some things, first aid things, sort of like, when to use heat, when to use cold, that's things that you certainly can follow, but most things, you really need to talk to your healthcare provider if you have any questions. It's called practice for a reason, because it's a blend of science and art. The science is the anatomy, the workings, the mechanical workings of the ligaments which connect bone to bone, the tendons which connect muscles to bone, the nerves which send electrical signals to the muscles to cause them to contract so they move the skeleton, and also the nerves is the portion of the nerve that sends the signal to the brain so we can interpret what we're feeling, etc. That's the science. The art is the techniques that we use to help folks. It's the treatment techniques hands-on. It's also modalities such as ultrasound, electrical stimulation. It's also what we teach the patient to do at home as part of their home program. So blending that all together, the proper timing and technique, and using the proper tools at the right time for that person's needs. And by the way, everyone is different. So, you can have the same condition. Let's take arthritis. Maybe a person has arthritis affecting both hands and or both wrists at the same time. Well, each hand will be a little bit different. And then you take that condition out of that person and put it in someone else. It could be their twin sibling, and they're going to react a lot different. So it's really, a moldable ball of wax, so to speak, where the practitioner, regardless of what profession they're in, the practitioner has to be very flexible and use basic principles, but always continuously reassess the situation and adapt accordingly. So, all right, let's get to it. Today I would like to talk about arthritis because it's something that affects, almost everyone. An old saying is that if you're over 40, you have arthritis, and that type of arthritis would be, from wear and tear, which is osteoarthritis. Osteo means bone. So you have arthritis, itis. The end of the word arthritis. Itis means inflammation. So tendonitis, inflammation of a tendon. Arthritis, inflammation of a joint. Arthro means joint. So inflammation of the joints, also wear and tear of the joint surface, which is the cartilage. If you look at the joint surfaces, in a chicken, for example, and you see that smooth, really tough portion on the end of the bone, that's the cartilage. Well, that wears out. So what I want to do, what I do on a daily basis, one-on-one with folks, is educate them how to reduce their inflammation and therefore reduce their pain. But how do you do that? There's a lot of material out there. There's a lot of information, especially in this world, it's information overload. And when do you use heat and how? What's the best technique? When do you use cold and how? What's the best technique? I always want my patients to understand why. Why are they doing what they're doing? And So for me, explaining it here on this podcast it's a wonderful opportunity because now I'm reaching more people at once, and it can get this word out there. So we just basically covered what is arthritis. That's the osteoarthritis, which I just mentioned, wear and tear. It's inflammation of the joints. Rheumatoid arthritis is a disease where the body's immune system is attacking the joint surface, and it's seeing it as something foreign and it shouldn't be there, and let's attack it. The basic principles of managing arthritis, which I'm going to talk about today, which I do in the office, basically it would use for any form of arthritis. The most common, of course, is the osteoarthritis from the wear and tear. And as I mentioned earlier, if you're over 40 years old, if you're 40 years old or older, there's a really strong chance that you have arthritis. Our bodies are designed to last optimally for about 40 years, and then just things start to wear out a little bit. Now, let's talk about heat versus cold, timing and technique. And as with most things in life, timing is really important. Even telling jokes, the comedian has to have good timing. When you're driving, you have to have good timing, and the things have to be timed. And success is in the details, no matter what we're doing. We can't oversimplify really anything and just say, well, you just do this all the time, or you just do that all the time. Nothing's ever that simple, regardless of what subject we're talking about. So let's talk about the benefits of heat versus cold. Heat expands, right? So I used to work as a welder a long time ago, and I know when I weld a piece of steel, it expands. Then I have to worry about the steel warping and et cetera. So it's the same with the body. So when you heat a part of your body, it's going to expand the vessels, which is going to bring more blood flow, which is a good thing, because blood carries oxygen and nutrients. And of course, that's what we want for the joint to maintain the healthy joint surface. Too much heat will increase inflammation, or too much intensity. So if it's too hot, it's going to increase inflammation immediately. If it's on for too long, it's going to increase inflammation. If it's on too often in the day, it's going to increase inflammation. Also, if it's on the wrong time of the day, it's going to increase inflammation. So what's inflammation? Picture now it's red, it's irritated, it's angry, it's starting to get a little painful. It's just inflamed. I think another good word is irritated. So it's expanded too much. It's really, really aggravated. It's, you think of like a, you can sit on the floor on the carpet, but you don't want to get a rug burn either. Timing for heat. So what time of day do you think that our inflammation would be at its lowest point? That would be the morning. Because when we're sleeping all night, we're resting, not really doing anything. Let's talk about arthritis of the wrist and hand. So all day long, you're not doing anything. And in the morning, you'll find that your wrist and hand joints are more stiff than anything else. The natural urge in the morning is to wake up and just get it moving, force it to go. Let's loosen that up. I ask my patients not to do that. The ideal thing is to get up in the morning, and if you start the coffee pot and start getting around and moving some things around in the kitchen, for example, your hand is waking up slowly, naturally, and that's what you want to do. If you force it, you can imagine that if you just force it, it's really stimulating the joint surface and waking it up very rudely, right? So we want to just let it wake up naturally. So because inflammation is at its lowest point in the morning, because we've been resting all night, sleeping, that's when we can get away with the benefits of the heat to increase blood flow to these joints that need optimal oxygen and nutrients. And it should be, what technique should we use? Electric heating pad is the most basic, and I think one of the most beneficial, one of two most beneficial things to use. The low electric heating pad, it has a thermostat, and you put on the lowest setting so it stays at a nice, low, steady temperature. The sack of beads that you hit in the microwave, it's hard to control the temperature, then immediately it starts cooling down. So what you want is a low, steady temperature with a thermostat for 10 to 15 minutes. I would do about 15 minutes, but not more than 15, because you can literally overdose on the heat, okay? So 15 minutes of heat in the morning upon waking. The person should always pay attention to the after effect. So the trappings of heat is that it will feel wonderful 100% of the time while it's on. Then the after effect is, now the inflammation is up if you use heat too much, or if you use it wrong, or the wrong time of day. Now the inflammation is increased. Now it hurts more. And what do you naturally remember? It felt great when the heat was on. So then you go back to the heating pad, put it on for another 15 minutes, and oh, relief, feels great. Take it off. Now it's even worse. And I've had people come in who, they're living in the heat. They have 3 or 4 heating pads, and they have them on all the time. And, and a lot of the year where I live, it's a pretty cold environment, so it's easy to really overdose on the heat. So, all right. So let's boil that down again real quick. Inflammation is at its lowest point first thing in the morning. You can get away with using heat for the benefits of increasing blood flow first thing in the morning, low steady temperature for 15 minutes. Now let's add another component that is very beneficial, and that's red light therapy. So red light therapy helps stimulate the cells to further reduce inflammation. We can get into that later in another video where we'll also talk about cold laser treatment, or a more focused approach. But what I like to use is this right here. It's a red light therapy mitt, and it has diodes in it. It heats up gently. It's a really nice heat source, very gentle, low heat. But you also have the benefits of red light. And I put my hand in this. If I have a busy clinic day and the base of my thumb, bothers me at the end of the day, where I have osteoarthritis starting to affect me, this really makes a nice difference for me. So I put this on for about 10 or 15 minutes in the morning. Sometimes, if it's a cold winter day and it's just really deep penetrating cold and I just can't seem to get warm, I'll do it. I'll do it again during the day. You can use heat as much as 3 times per day for 15 minutes. And we'll talk about that a little bit more. Again, in life, there's exceptions to every rule. So there's baseline, principles that we follow, but we'll talk about some of the exceptions. All right. So this is just another mode of heat. The red light mitt, also with the benefits of the red light. Now, picture this. Now you're going to go to work. You're using your hand, and whatever you do, making sandwiches, typing a lot, working mechanics on engines, doing what I used to do, welding and machining, and you're using it, aggravating it, irritating it, moving it, and then you go home and it's really sore, or during the day it gets really sore. Well, there's some really great techniques for cryotherapy, or just cold therapy. And one of those is cold running water. So studies have shown that putting your sore, inflamed, angry joint under cold running water only until it's deeply cold, 10 to 20 seconds, whatever it is, just to get it deeply cold, that is better than an ice pack for 10 minutes. When I was a kid, my family, we would go to vacations in Maine, go to Old Orchard Beach. And I remember it was 85 degrees out, and we couldn't wait to get in the water. And we go on the ocean, and immediately your ankles and knees start to ache because it's deeply cold, and we were out of there. And that took about 20 seconds. So that's a similar thing. So some patients, I'll have them every time they go to the bathroom and wash their hands, and with cold running water, keep it on there until it's deeply cold. Done, quick and easy. And I have some people come in and they're so inflamed, and they've been constantly moving, trying to keep it loose. We're going to talk about that too. They're rubbing it. We're going to talk about that too. And it's just irritated, and they're in agony, and they're taking pain medication, nothing's working, and they're keep, re-aggravating themselves. And we'll have and then I sit down with them and we have what I call the talk about stopping habitual range of motion movement, stopping self-massage. And then I'll have them use the cold running water every hour. Another good trick of the trade, they'll use it every hour until they get a handle on it, get things calmed down, and then we can, normalize it a little bit just for maintenance. Another little trick of the trade is the old water pitcher or a container that you can just keep in the fridge full of water. And that's about 38 degrees Fahrenheit. And you just take it right out and stick your wrist and hand right in it until it's deeply cold. Done. Easy. Dry off and put it back in the fridge. Don't use your parents' or your spouse's fresh made iced tea. If there's ice cubes in it and there's lemons floating in there, that's probably not your hand dip, right? So anyway, that's another nice technique of cooling it down. So let's start again from the beginning. Low heat in the morning, 10 or 15 minutes upon getting up in the morning, okay? And we talked about the techniques: low steady heating pad or the red light therapy mitt. And then during the day, you're using it, aggravating it. Now we're going to tamp down the inflammation with cold. Another good technique is just have a piece of ice in the freezer. You can hold a regular ice cube with a cloth or something and put ice directly on the skin. Ice is hard as a rock, of course, so you don't want any deep pressure. You want to rub a rock in your sore joints, obviously. So you just barely touch the skin with the ice cube, and it'll melt over it, and then it'll get deeply cold, and then you put it right back in the freezer. A Dixie cup works good. If it's a plastic Dixie cup, just fill it 3/4 full, break the top, and then take the whole thing out. Then you have a nice, cylinder you can hold on the end with a paper towel or something, and then do the direct ice. Or if it's a little paper cup, you can peel off the top, and then now you have a paper handle on the bottom, and then you again put the direct ice. So minimum of direct icing if you're sore, it's inflamed, lunchtime, and then, dinner time and before bed. But now let me ask you this. When you think your inflammation is at its highest point, that's right. It's at the end of the day. So you're using it all day, aggravating it, irritating it. We put our hands and fingers through a lot. At the end of the day, that's when things are most irritated. And, people will also complain, boy, it's have a hard time getting to sleep. I wake up in the middle of the night with pain. You know what? Cold water dips or direct ice or the cold running water before you go to bed, quick and easy, and it'll zap down the inflammation. Another thing we do is I do with patients is I'll have them even put a layer of castor oil, CASTOR. Don't drink, it'll make you go. It's a natural laxative, but it's also a natural inflammation reducer topically. And I sometimes I'll put it on the base of my thumb if I'm going to sit down and watch a movie, and I'll just wrap a towel around my hand and wrist so I don't get the furniture oily, and I just let it soak in. Then after the movie, I just wash it off, and that's another good tool. So low heat in the morning, cold during the day, ideally midday, after work, also perhaps after dinner if you need it, but especially before going to bed. And then when a joint's stiff, you move it and it's just tight, and the urge is to just keep it moving, loosen it up. Oh my goodness, it's stiff, I gotta loosen it. One of the biggest reasons why it's stiff and tight is because of the inflammation. So picture it's inflamed, it's irritated, it's red, it's hot and swollen, it's expanding. So there's only so much space in there. And when you talk about the wrist, by the way, and we'll talk about this later, there's 15 bones that make up the wrist. And there's 24 contact surfaces. 24 contact surfaces. So talk about wear and tear. We'll get to that later. So low heat in the morning, cold during the day, and then, the urges of keeping it moving, trying to loosen it up. So because it's inflamed and irritated, it's going to be tight. So when we move it and force it and get it going and and kind of just keep it moving. Well, at the end of the day, a lot of people have, you have 1,000 repetitions, 2,000 repetitions. If somebody who didn't have arthritis and didn't have pain did that with their hand, they would have pain and they would have arthritis. They would have inflammation of the joints. So that's really important to break that habit. And I joke with people, go to the craft store, get a big red bow about this big and tie it to the back of your hand. And if anybody asks you, what's that for? You say, well, I can't forget to pick up bread and milk on my way home. But that'll definitely stop you from the habit. Also, massaging. So when you hit your shin on the coffee table, the first thing that we want to do is reach down and rub it, which that makes perfect sense because deep pressure, and watch this. This is pretty interesting. Deep pressure releases chemicals in the cells that slow the communication to the brain of pain. So deep pressure actually reduces pain. Now, if we did that in our wrist, we want to rub, all the patients come in for their first visit and they're sitting there and they're rubbing their fingers, they're rubbing their hand, they're rubbing their wrist. And then we have that talk. And then, it makes mechanical sense that if you're going to aggravate it because it's living tissue and it's shallow. So, when you touch the back of your hand, you're touching the bones, you're touching skin on the surface. There's tendons that connect muscles to bone, and there's ligaments. There's stuff in there, but it's shallow. I mean, you can touch the bone. It's all on the surface, and there's a lot of moving parts. So we talked about the 24 contact surfaces, the 15 bones in that region of the wrist. There's a lot there, and it's shallow, and it's very easily aggravated. And rubbing that is going to feel good at the time while you're rubbing it, and that's a trap too. It's going to feel good at the time while you're rubbing it, but then when you stop, and now it's more inflamed, and guess what? Now it hurts more. And then you remembered, felt great while I was rubbing it, so let me keep rubbing it. And it really easily becomes a habit. And it's the hand and wrist. So, if it was your foot, you'd have to take off your shoe and take off your sock. Or who would make that a habit, right? But it's the hand and wrist. So it's right there. It's handy. How's that for a pun? It's handy. It's right there. And you can just sit there and rub it all the time. So that's what you certainly do not want to do. So I'll have people come in complaining of 8 out of 10 pain, 9 out of 10 pain, 7 at rest, 9 with range of motion, and they're just in agony. They're taking anti-inflammatories and they're taking pain medication, and nothing is working because they just keep reattacking it. All right. So sometimes in life, what you don't do is more important than what you do. And there's a right amount for everything. One really simple analogy is after you make a sandwich, you got to wipe off your kitchen counter, right? But you can't wipe it and scrub it so much that you wear off the finish. Anything can be overdone. And this is, it's very, very easy to overdo it. So our body, all of our tissue is this living tissue. One analogy I like to use in the clinic is gardening. Let's say you want to grow really nice tomatoes and you say, well, let's speed this up a little bit. Instead of watering them once every other day or every morning, I'm going to water them 8 times a day. Well, you're going to kill the tomato plants, so that's, it's sort of like gardening. The patient comes back. What do they look like now? How are they presenting? Okay, the inflammation went down. The pain was 8 out of 10. Now it's 3 out of 10 at rest. With movement, okay, it's going up to 5, but it's not 9 anymore. The literal circumferential measurement of the wrist size went down by 50%. The fingers are smaller. Looks good, but now what problems remain? Okay, well, let's work on those, and we have some other tricks up our sleeve for these things. So that's kind of how it goes, and it's a lot like gardening. So that message is really about, of course, your clinician is going to pay attention to how you're responding, but pay attention to yourself. What is the after effect of what you're doing? So you water the tomato plants. You know what? They're wilting. So I'm going to water them some more. They're wilting more, and the plant's doing worse. Okay, well, let's not keep doing the same thing. We're going to have to make an adjustment, dial back on the water, cut back. So really monitor yourself. All right. So we went over heat and cold, timing and technique. Paraffin is something that some patients ask for. They've had in other clinics. Paraffin is a heat source. It's melted paraffin wax in a heated container, and you stick your wrist and hand in it, maybe before therapy to warm up the tissues. And you might put a few layers of the wax on and wrap your hand in a towel or put it in a mitt and sit there and warm up for 10 minutes or so. It's just a heat source. It feels good on the skin because it has a moisturizing component. It's messy. I don't use it because, again, it's just a heat source. And using a low heating pad in the morning at home is ideal, or the red light therapy mitt. There's also cold laser therapy, which I mentioned, and that is bright red light. We call it cold laser because it's not a hot cutting laser. It's in the spectrum of red light that studies have shown stimulates the mitochondria, or the powerhouse of the cell, to produce more ATP, or healing chemical. So what's really interesting with cold laser is that bright light, which you don't feel, by the way, that bright red light, is the best of both worlds between heat and cold. So heat, let's talk about the benefits and the drawbacks. So heat increases blood flow, which we talked about earlier, brings more nutrients and oxygen to the joints, to all the tissues, but also expands inflammation. Okay. Now, cold will reduce inflammation, but will also vasoconstrict, or constrict the blood vessels. So if you're constricting the vessels, then you're reducing the amount of blood, the amount of oxygen and nutrients getting to the tissues. So, again, in life, there's a drawback to everything, right? Now, with the laser therapy, it's the best of both worlds. It increases blood flow while at the same time decreases inflammation. And that's very useful. In like anything else, some people benefit from it a great deal. Some people don't benefit from it very much. Most of the time, you need at least 3 treatments to have an effect. Every spot that I put the cold laser treatment on typically only takes about 23 seconds per location, and you don't feel anything at all. There's a couple of reasons. There's 2 main reasons why we would not be able to use cold laser in the clinic on a person, and that's A, if they're on an immunosuppressant medication, something that suppresses their immune system, such as if somebody has rheumatoid arthritis, for example, where the immune system is attacking the joints, and they're taking a drug to inhibit their immune system, then we don't want to use the cold laser with that. B is if they're on any medication where your doctor or other provider tells you to cover up when you're out in the sun. If it makes you sensitive to the sun, then of course we want to put a bright red light. We can't do it over tattoos because it just superheats the skin, or people with very dark pigmented skin. The risk is you're going to overheat the tissue. Now, of course, we want to use the tools of heat and cold appropriately. We want to stop the frequent movement. We want to stop the self-massage. But what else can we do? So, it did all these things, and let's say that the patient has significant degeneration, which means the joint is, it's misshapen. There's bone spurs are forming. Let's talk about bone spurs for a minute. Here's something interesting. What's happening with bone spurs is the body knows that it's bone on bone, the cartilage is worn off now, and the body wants to fuse the joint. And if you fuse the joint or rust the hinge together, right, it's not going to keep moving, and it's not going to be painful anymore because it's going to be fused. And that's called ankylosing. So it doesn't happen in the fingers. The fingers will become misshapen with what's called Bouchard's nodes at the middle knuckle on the finger, and Heberden's nodes on the last knuckle of the finger. And you'll see those knuckles will be large, and sometimes we get angulation deformities, but it doesn't fully fuse because we use our hands during the day and they keep moving. It's sort of like a stream that doesn't freeze in the winter because it's moving. With that mechanical misshaping of the joints, a lot of times people will just have some pretty frequent but sporadic stabbing pain in the wrist and the fingers, or maybe it's one joint that's worse than the rest. Let's take the long finger, and that's out there in the world more, and people end up hitting the end of the long finger or the middle finger more often because it's longer than the rest of them. It's just the first one to make contact with things. For example, I had somebody complaining of discomfort, and I have this nice waterproof elastic tape. It's called kinesio tape. You might see athletes with their shoulders taped and their legs taped with different color tape. It's the same stuff. But if a person is, they know that they're going to go out and rake the lawn, or they're going to use the weed trimmer, or anything that they know that, oh boy, I'm going to pay for that later, they can put this on and stabilize the joints, give that some stability, still lets them move, and maybe they wrap, a couple layers around it. There's also which is helpful sometimes, is just some medical tape. This is cloth tape, which gives a lot more stability. And I had a guy the other day with just a lot of really intense arthritis at the end of the joint, and we just stabilize that. And when he's at work, he'll wear this and then take it off. Just kind of use it as a crutch when he needs the support. Also, Coban is very handy. These all have different properties, so this is where practice comes in. It's we're being creative for people to help decrease their symptoms, but at the same time allow the hand to remain functional. And this is handy, as is the kinesio tape, to wrap right around the wrist and give some circumferential support, because remember, in that wrist region, 15 bones, 24 contact surfaces. So sometimes it just needs a little hug, so to speak, and some stability when we're asking a lot of it. Some folks will really benefit from a figure of 8 wrapping of ace wrap around the hand and wrist, figure of 8 style, to make a brace. And speaking of braces, I see people come in a lot with, it's they're having a lot of wrist pain, and they go to the store and buy an over-the-counter brace that has, most of them are nylon, the thick, heavy nylon with a stiffener bar inside. And a lot of the stiffener bars are right here on the palmar surface of the wrist, but that puts pressure right on the carpal tunnel. And we have another episode coming up, which is all about the carpal tunnel. And I'll just show you real quick right here. The carpal tunnel is made up of the carpal bones. And these bones, when you look down onto them, they form a concave shape, and over the top is a thick, heavy ligament that forms the tunnel. So there's 8 carpal bones, and then and they rest on the end of the radius. There's the end of the ulna here. Then you have these 5 metacarpals, and that's the 15 bones that I was speaking of earlier. So there's a lot going on there. A key structure that passes through the carpal tunnel is the median, median nerve. The median nerve is about as wide as a pen or a pencil, thick like a noodle. It's big. So when you have pressure on a nerve, you get numbness and tingling. When you cross your leg and your foot goes to sleep, that's not due to a lack of circulation. That's due to pressure on a nerve. So when you're having numbness and tingling on the thumb, index, long finger, and or part of the thumb side of the ring finger, that's the median nerve. And these nerves plug into specific areas. So it's, they're the wiring system of the body. So if we can determine what nerve is being compressed by what area the patient is feeling the symptoms. However, the difficulty comes in finding where is the nerve compressed up through the system or up through the chain. Nerves come they come from the spinal cord out of the spine and go through the armpit, then branch out, and then innervate or plug into several different areas. But finding the location of the compression is the challenge, and we'll be talking more about that later. So we went over wraps, braces. We talked about the over-the-counter splints and with these stiffener bars. When patients come in, I'll have them bring whatever splint they're using, and I'll pull the stiffener bar out of the splint. If they can continue using the splint without the stiffener bar, then good. They don't need to get anything different. I make a lot of custom splints or custom orthotics where I would make a template on the patient. I cut it out from flat stock and mold it onto the patient and make the splint do whatever I need it to do, whether it's stabilize a joint or maybe the splint has cables on it and to stretch a joint, to stretch a finger, stretch a wrist, stretch an elbow. We can make the splint do whatever we need it to do. We use those mostly for traumatic conditions. Somebody falls and breaks a bone, or they're in a car accident, et cetera. And we get a lot of tendon injuries where the tendon needs to be repaired, and we need to make a splint to protect that repair. With arthritis, occasionally we'll make a thumb spica brace that positions the thumb in a more comfortable position and relieves pressure on the base of the thumb if they're having a lot of arthritis problems there that they can wear for activities that provoke their symptoms. There is one over-the-counter brace that I like to use a lot. It's this neoprene brace made by Comfort Cool, which actually makes a sling around the base of the thumb and gives that good support. And patients will wear this, just when they're out stacking wood or, working the garden, and that will really provide support exactly where it's needed. Another good trick of the trade, and I just had 2 people come in this week where the custom brace or the over-the-counter neoprene brace without stiffener bars, it helps significantly, but you know what? The patient just needs more. So what I do for that is I like to use the kinesio tape, and I make about 1.25 inch, inch wide strip that I can wrap around the base of the thumb where the thumb meets one of the carpal bones that I just showed you. It's called the trapezium, and I'll show that to you in a moment. And this tape can be put on I have patients secure it to the back of their hand, and then bring it around the base of the thumb. And you see that first bone of the thumb, and I'll teach people to feel that bone, and then where it steps off, that's the end of the bone, and half of the width of the tape should be right on the end of that bone, and it gives that support. And then they can wear the brace over the top of that. I have a person who works in a school kitchen, and she's carrying heavy things and moving things and stirring, and she'll wear the brace on the top of this, and then if she has to get her hand in water, she'll take the brace off, and then she can use her hand in the sink, and this waterproof tape is still giving her support. And then when she gets home, she can just take them both off, and she doesn't have to use them because she's not in her work environment that's aggravating her. So the base of the thumb is an interesting area. It's called a saddle joint because it's like 2 horses' saddles. It moves this way and this way. And there's a price to pay for everything. And the price we pay for all this movement is more wear and tear. So the weight-bearing joints, the knees, the hips, are some of the most common for osteoarthritis, but also the base of the thumb because of all the movement that it puts itself through. So that is right here, and I want to point that out to you. And I was showing you that bone. I have people feel and then step off the end, and that's the end of that bone. That tape in sling fashion will go right on the base of that bone. That's the trapezium. And all these carpal bones have a name. The trapezium and the scaphoid and the lunate and the triquetrum and the pisiform and the hamate, the capitate and the trapezoid. So, these they all have a purpose. They're all very important. And that's why, these are continuously being studied. We're learning more about them. We're learning how the carpus or the carpal bones, how they're assembled, how they affect our movement, how they affect the wrist, how do we decrease pain, and that's another much longer show when we start getting into that. So let's wrap it up with what not to do. And I really want to stress that sometimes what we don't do is more important than what we do. So don't keep it moving. The urge is to keep it moving. I got to keep it loose. Boy, it's tight, but moving it and moving it and moving it some more, it just keeps it inflamed and makes it more tight and increases your pain, okay? Second thing, excuse me, don't rub it. Don't massage it. If something hurts, it's natural to want to reach down and rub it, massage it, but not this. The bones and tendons and everything is shallow. It's right there, and you're actually touching the joint itself, and aggravating the living heck out of it. So you don't want to do that, okay? And then use over-the-counter braces with the stiffener bars, and those stiffener bars, they dig into different structures. I got thumb pieces here. My goodness, I pulled this out of a splint. This was over a thumb and its fingers. It's just, who wants this rubbing on them, right? So, over immobilized. So if we just rest it all the time, that's no good either. The body is terribly efficient. The body will not maintain anything that's not being used. So if it rests too much, that's a problem too. And then your arthritis will advance a little quicker. So there's a happy medium there, and your therapist can really work with you on that. Now I want to end with a dedication, and I dedicate this show and every show to Jesus Christ, my Lord and Savior, who continuously guides me to do right, to do well, and to continuously improve. And my wonderful wife, who continuously encourages me to follow my dreams. Also my wonderful family, my teachers, and the community who raised me and taught me my values. And my professional mentors who were and still are patient with me and continue to answer my questions and empower me to help others to my greatest potential. Thank you for watching. Thanks for listening.